Welcome to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti. My guest this evening is Dr. David Banach from UConn Health. Dr. Banach, welcome. How are you?
I'm doing well. How are you?
Good. Well, Happy New Year. It's been a while since we've seen each other.
Yeah, I think it was last summer, maybe.
It was. It actually was.
Last time I saw you.
Yeah, it was last summer, and you actually came down, but due to circumstances beyond our control and the weather, we're doing it this way tonight.
Well, thanks for having me on, even if it's remote.
Thanks for sticking around. Thanks for coming down. So, Dr. Banach, tell us a little bit about yourself and how long you've been with UConn Health.
Sure. So I'm an infectious disease physician, so a clinically trained physician with a specialty in infectious disease. I have been at UConn Health since 2016. In my current role, it's a mix of taking care of patients in the hospital and in the office. And I also am the medical leader for our infection control program at UConn Health.
Now, what do you do with the infectious control program at UConn?
So a lot of that is focused on all the measures that we have to be able to prevent or detect and prevent any infections associated with healthcare. So, that includes things to protect our patients from infections while they're in the hospital, and also to protect our employees as well from infections. So it's somewhat of an administrative role, but involves a lot of data analysis and also the application of infectious disease principles.
Now, tell us what you do exactly as an infectious disease specialist.
Sure. So my clinical role is a mix. So I see patients in the hospital, a lot of times patients that have complicated infections,
Okay.
Maybe infections that requires special treatment out of the ordinary. Antibiotic-resistant organisms is a big focus of my practice. And then in the clinic, I see patients with sort of less severe infections or maybe chronic infections, you could say. So, things like HIV infection, hepatitis C infection, those we take care of in primarily outpatient settings. And I also see patients who are coming out of the hospital and may require some sort of long-term antibiotic treatment for their infections.
Now, do you teach as well or no?
I do. So I teach our learners in the medical school. So we have medical students that I teach. And we also have residents, so doctors who recently graduated and are doing specialty training. I teach them in the hospital and in the clinic. So kind of a mix of different learners that we have at UConn Health.
You like it?
I do. Yeah, no, I think one of my favorite parts is the teaching aspect of my work. And I like that it's a mix of sort of clinical work, teaching, and also some of the research and administrative components as well.
Now, as far as topics for this evening, why don't we just start at the top and talk about COVID and what's going on with the COVID?
Sure.
With COVID.
So we are seeing, we're seeing COVID. It's certainly not like what we saw, in the early phases of the pandemic. We're seeing COVID, it's becoming more of what we call an endemic infection. So, we see infections in the community, and most patients with COVID currently have milder infections. So we, they can stay at home and manage and recover. Sometimes we do see folks get admitted to the hospital with COVID. That's becoming much less common than it was earlier in the pandemic. That's probably a mix of folks, particularly high-risk folks, having prior immunity from vaccination or previous infections that's resulting in milder infections. But, it's still out there. We're still encouraging preventive measures, particularly for higher-risk folks, to try to avoid getting sick. And, we have now a lot more tools than we used to in terms of antiviral treatments and supportive care for patients that do get sick.
I actually was a colleague here at the station just said something to me, and she was like, I was watching TV the other day and saw an ad for Paxlovid. Can you maybe tell us what Paxlovid is?
Sure. Paxlovid is now the primary antiviral medication that we use in most folks that have COVID infection,
okay.
Particularly those at higher risk. So it's an oral medication, antivirals. It's been now available, I would say, for the last maybe 2-3 years or so. And now it's kind of our first line go-to for patients who test positive and are in a group where they need to get some sort of antiviral treatment. And that generally tends to be older folks or people with underlying medical conditions that are at higher risk for progressing to more severe infections.
Now, for some reason, I thought that there wasn't a medication for COVID. Obviously, Paxlovid does the...
Yeah, Paxlovid is really our best option. We have a couple of other options as well, antiviral medications.
Okay.
One of them that we use for our hospitalized patients is called remdesivir. It's a different type of antiviral, and it's only administered intravenously. So we really use that primarily for our hospitalized patients, whereas those who aren't hospitalized, Paxlovid is really the first line choice of medications for them.
Now, what are the other choices of medication in case you have COVID?
There's a couple of alternatives, antiviral medications that don't quite have the amount of data that Paxlovid and remdesivir have in terms of preventing illness. And then there's some other measures that we can give, not so much antiviral medications, but for patients that are sick with COVID, we can give some additional medications to reduce the inflammation and try to prevent patients from getting sicker from COVID. Sorry about that.
Now, as far as Paxlovid goes, how effective is it?
It seems to be very effective. It was, the data when it first came out showed that it was quite effective in preventing hospitalizations.
Okay.
I think the most impact is really on those more vulnerable individuals, more vulnerable by age or by medical comorbidities. And it needs to be given early too. So I think in that combination, it can be impactful. We may not see as strong a benefit as we saw originally now that a lot of folks have pre-existing immunity to some degree from either previous infections or from vaccination. But I think it's still there, and for those high-risk patients, I still think it's worthwhile.
Now, what are the numbers we're seeing in COVID because of the uptick that we've seen recently?
No, we're seeing an uptick, particularly in the last couple of months here in Connecticut. We've seen an increase in COVID infections, both in hospitals, admitted patients, but also in the emergency room patients that may have less severe infections. We don't quite have the tracking that we used to for COVID. Okay. Some of that is a little bit not as, or it's not quite as robust as it used to be. Plus, we have a lot of folks that have mild illness and either don't test or, test and using a home test, and their infections may not get counted. But, based on the surveillance kind of estimates, it does seem like in the last couple of months we've had an increase. There's some optimism that it might be plateauing based on what we've seen the last few weeks. But we'll have to stay tuned and keep an eye on it. In the next, I think, few weeks, we'll get a sense as to what the trend is looking like.
I was going to say, you think it's going to go down?
I think we're going to see COVID as like a winter virus. It's going to be with us. I don't think there's any expectation that it's going to go away completely. And I think, we'll see upticks here in Connecticut in the colder months. We may see that again in the future, but, hopefully it'll have some seasonality like we see with some of the other respiratory viruses like flu and RSV.
Now, as far as COVID goes, what's the difference between the different types of vaccines that you get, the different shots between the Pfizer, the Moderna?
Yeah, the Pfizer and Moderna vaccines, they're quite similar. They use the same type of technology, and they've been updated in a similar way. So you may recall last fall, or late last summer, the updated boosters became available for Pfizer and Moderna. And those are really the primary vaccines that we're administering at this point for COVID. There is another vaccine called Novavax, uses a slightly different technology. It doesn't have as much data behind it as Pfizer and Moderna vaccines do. We just haven't used it as much. But that's another option that's available and people can get access to.
Now that the COVID vaccine has been around for a couple of years, are there any side effects that people are seeing?
Yeah, I think generally speaking, the vaccines have been very well tolerated. We do have folks that sometimes get a very robust, immune response. Sometimes that can result in symptoms like, severe fatigue and malaise. And then the one thing that has come up in, particularly in younger populations, is in some pretty rare situations, there can be some inflammation in the heart. We see that mostly in adolescent and young males. But even in that situation, it seems to be quite uncommon. But that's the one side effect that has gotten some attention. But I think for the most part, particularly for older adults and and those groups that are highest risk, the vaccine is generally well tolerated.
Now, what groups are at highest risks of catching COVID?
So, I think when it comes to actually getting COVID infection, by nature of being in the general public, being around other people, everyone's going to be at risk. It's those groups that have that are older age, that have other medical conditions, things like diabetes, heart problems, lung problems, immune suppressed. Those are the ones that get more severe infections, and that we need to be particularly attentive to when it comes to focusing on vaccination and giving antivirals early on in the course of infection to prevent those more severe outcomes in people with those risk factors.
All right, we're going to move on we're going to go from COVID to the flu.
So flu actually has seen a bit of an uptick this year, maybe even more so than in previous years,
Okay.
At least recent years since the pandemic started. Here in Connecticut, we're seeing influenza, and in the last few weeks, we've seen an uptick in influenza, both in the community and also in the hospital. So, something that should be on the radar. We now, have that in our sort of in the forefront of our minds when we see folks coming in with respiratory symptoms and fevers, that we are seeing flu occur. And, I think we have to be mindful of it. The vaccine this year does seem to be a good match with the currently circulating strains. I think vaccine uptake hasn't been as high as it's been in the past. So I think we still need to get that message out there that flu is circulating, and vaccine is still available and still important.
Now, what's the reason for the uptick in the flu?
I think it's hard to say. We see different patterns from season to season. Even pre-COVID, some seasons were worse than others. It may have to do with the circulating strain that may be, more contagious from year to year. And I think there's some concern that flu vaccine rates may have dipped a little bit, and that's we can talk about other vaccines as well. But I think that may be something that is playing a role here. But we have to keep an eye on it, see what happens season to season. There's some optimism that we may be peaking with flu season based on what we've seen the last couple of weeks. But I think that's something that we're going to have to keep an eye on moving forward.
Now let's talk about the other vaccines that are available for the flu.
Sure. So we have many vaccines available for flu. These are the vaccines, they've been around for many years using that type of technology. They all sort of use a similar type of technology in that they help generate that immune response to provide protection for people should they get another exposure to, or should they get an exposure to the flu virus. They are effective, and these vaccines have a long history and seem to be quite well tolerated in terms of any side effects. So, again, I think, the recommendation this year is for everyone over 6 months to get a flu vaccine. I think, I do encourage folks to go ahead and get that to provide protection.
Now, are there differences in the flu vaccine, or is it all the same shot?
They're quite similar. There's a couple of the major differences that for older folks, there's a high dose flu vaccine that's available and generates a bit of a stronger immune response and a little bit more protection for those older individuals. So, if you're in that older group, talk to your physician to see if that high dose vaccine is the right vaccine for you. And if it is, by all means, that would be the right vaccine.
And in your mind, how important is it to go out and get your flu vaccine when it becomes available?
Yeah, I think it's very important. The general recommendation is to try to get it early on in the flu season, like in the fall and early winter. So now that we're kind of a little bit further into the flu season, but I think it's still worthwhile. I mean, the vaccine helps provide protection pretty shortly after people get it. So, we still have flu circulating. It's not too late to get that flu vaccine if you want to try to protect yourself, in the weeks to come from the flu.
Now, what is the flu vaccine? What is the flu season? What months does it run?
Varies. So,
Okay.
sometimes we see it early season, sometimes we see it later. Generally, we think about flu starting around like November and, typically going through like March.
Okay.
But in some years we see flu activity here in Connecticut extend past March, even until like April. I expect flu will be around at least in the next few weeks. We'll have to see what the trends are showing us.
Absolutely. Now, tell me, what exactly is RSV?
So RSV stands for respiratory syncytial virus. It's another respiratory virus, and so it affects the respiratory tract, the lungs, the upper respiratory tract, like the airways and the throat, and it can cause a similar illness to flu and even COVID, in some individuals, particularly older individuals, immunocompromised individuals, it can cause quite severe infection, leading to hospitalization. The other group that we have to be attentive to with RSV is young children. They seem to be, like babies, they seem to be particularly vulnerable to RSV infection. And, when young children get infected, that can often result in hospitalization and more severe infections.
Now, is there a vaccine for RSV?
There is. So there's a vaccine that recently became available this past year. Just got FDA approval after some large clinical studies that were performed.
Okay.
And the vaccine is currently available for older individuals. So as I mentioned, older individuals are the ones at highest risk for more severe infections. So the vaccine can help prevent can reduce the severity of infections in people that receive it. So it's currently indicated for individuals over age 60. I think it's worthwhile, to get that. It's something that ideally you get early on in the RSV season, which is generally in the fall, winterish. But I think it's a good vaccine, and we're seeing good results from it.
Now, you said that the RSV vaccine is available for the older community out there, and what would that age bracket be?
So we're looking at individuals who are over 60 is the current indication. So anyone who's over 60 is eligible for the RSV vaccine. This year, because it's a new vaccine, it's been a little bit harder to find. Not all pharmacies may stock it, but it is available. For individuals over age 60, I think it's worthwhile to prevent severe infections. The other group, as I mentioned, that we worry about with RSV infections and severe RSV infections are young children.
Okay.
So the other group to vaccinate are actually pregnant women. So we vaccinate pregnant women that can reduce the infection risk to young babies. So that's the other group that's been a focus for, and that the vaccine's approved for. And then lastly, I'll mention there is a different type of vaccination that's available for babies. And it's given usually right after birth, and that helps provide some protection to the baby as well from RSV.
Now, why do you think the RSV shots are so hard to find?
I think it's a relatively newly available vaccine. It wasn't as quickly distributed as the COVID vaccines were when they first rolled out. And flu vaccines, they've been around for a long time. There's many different manufacturers. There's a lot that's produced, whereas the RSV vaccine is somewhat limited in terms of production. So I think those are the factors that kind of come into play in terms of availability. But I expect that in the months and years ahead, it'll become increasingly available and hopefully get to the point where it's no problem for anyone to get an RSV vaccine if they want to. But here, at this point, you still need to look a little bit, call around, and see if different pharmacies are stocking it or not.
Now, is there for the RSV vaccine? Should you get a new shot every year or every couple months, or does it wear off after a while?
We don't know that yet. So right now, the current recommendation is a one-time vaccine.
Okay.
Whether there's going to need to be boosters or further vaccines on some regular basis, like once a year, every few years, I think we don't know that yet. So with time, we'll know how long that protection lasts from the initial vaccine. Those individuals who are included in the studies are still being kind of tracked to see if the protection kind of wanes over time. Okay. But I think that's something that we just need more time to really understand. But right now, the recommendation is just a one-time vaccine for those who are eligible.
Now let's talk about vaccines in general as a whole.
Yeah, so I think vaccines have gotten a lot of attention in the last few years, especially with COVID and the COVID vaccines. And I think one thing that is at the forefront of our mind is vaccine uptake in general. There's been a lot of different uh, I think a few different factors come into play. So with COVID, there's a lot of disruption to healthcare in general. So there was a period of time during the peak of the pandemic where people may have had a hard time getting to healthcare, maybe not have been able to access routine vaccines as readily. So that's led to declines in some vaccines that had been pretty universally uptaken. And then, the other piece of it is I think there's some hesitancy out there about vaccines. The COVID vaccine, got a lot of attention. Much of it was very positive, but there was some, negative attention and certainly some controversy that came up about these vaccines. And I think that's unfortunately had an impact in routine vaccination, particularly among children. And that's something that, I think we need to really be attentive to. We saw even pre-pandemic that vaccine rates among young children for routine childhood vaccinations have been declining. And that raises some concern that some of the infections that we haven't seen very frequently, that they may make a comeback. And we may be seeing more and more of them when we have larger groups that are not vaccinated to protect against them.
Now, back to COVID for a second. Do you think we're going to see a yearly booster for COVID?
I think we don't know for sure, but there's a pretty strong indication that there'll be an updated COVID booster that'll become, sort of seasonal. So based on the circulating strains, we've seen that the COVID strains can change. I think in the past we've discussed, going from the Alpha variant to Delta variant, and most recently Omicron variant, and then subvariants. So we're seeing them change, kind of like the flu has in the past. So, each year we get an updated flu vaccine based on the circulating strains. I think there's pretty good anticipation that we're going to see the COVID vaccine be updated. I don't think we know exactly how often that's going to be and what the optimal boosting frequency is going to be. But, I think there's some expectation that individuals, particularly higher risk individuals, are going to benefit from an updated COVID vaccine.
Now, the COVID vaccines, as they are available now, they're pretty readily available at your local pharmacy or your local drugstore, correct?
Yeah. So now COVID vaccines, remember at the beginning when they were first offered, were very hard to come by.
Oh, yeah.
But now they're quite readily available at pharmacies, retail pharmacies. Pretty much any pharmacy that offers any vaccination is going to be able to get access to a COVID vaccine. And now they're also being made available at doctor's offices. So, for instance, our practice at UConn Health, we offer COVID vaccines in the office. And we're seeing less of those kind of mass vaccine distribution like we saw like early in the pandemic where you had to go to like a specific location to get like a vaccine. And now they're becoming more like regular vaccines that are available in doctor's offices and pharmacies.
Now, are they, I remember during the start of COVID that they used to, if you go online, sign up, and then they can mail you the COVID test kits at home. Are they still doing that, or?
They are. So COVID test kits there was actually just a recent announcement that vaccine kits were there was another shipment being made available for people who request them. And you can go online, and I think it's still active, that you can order, I don't know exactly how many quantity, but some quantity from the government of COVID tests available to you. The COVID tests are now also pretty readily available for purchase in pharmacies. Unfortunately, the price of them is not as low as we may like them to be when they're purchased at pharmacies, but they are available. And, like I said, I think the federal government still has them available for free. I couldn't recall exactly how many each person's allowed to get, but they're available online if you search for them, and can get them shipped to your house.
Now, as far as the COVID tests go, are they pretty easy to administer if you do a COVID test at home rather than if you go to like the doctor or?
Yeah, now the current test kits, are available for self-testing. They're, I think, pretty easy to administer. For some folks that may not have the dexterity or just may not find them to be as easy to administer, their testing is still available in clinical offices. So they are available. They seem to be working well in with the current strains that are circulating. I think one thing that's come into play is we're seeing that in folks that have either been previously infected or vaccinated, the time to the test turning positive may be a couple of days longer than it had been from symptom onset. So I encourage folks that if they do want to test for COVID after having symptoms and the first test is negative, to retest again to feel a little increased confidence in the result.
Now, if you tell somebody to test again, is there a waiting period between test 1 and test 2?
I think there's no perfect waiting period, but generally we say about 24 hours after the first test to do a repeat test.
And it's pretty easy to do the self-test, correct?
Yeah, I think generally, the instructions are good, and they're, and people feel pretty comfortable with administering them.
Now, as far as the test kits go, do they expire after a certain amount of time, or are they good for?
They do. So yeah, I think that's an important point, that these test kits, like any other test that we use in healthcare, the chemicals in them do expire after a certain period of time. So be sure if you're going to test to check the expiration date. If it's a test that you may have gotten years ago when the test first became available, they may expire. So double check the expiration date if you're going to be using a test.
Would you mind sticking around for another segment?
Sure, no problem.
All right, we'll be back. We'll be right back. Welcome back to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti. My guest this evening is Dr. David Banach from UConn Health. Dr. Banach, welcome back.
Thank you.
Thank you. So, Dr. Banach, we were talking about RSV and vaccines in the first segment. Let's talk about the concerns regarding the childhood vaccine and the reemergence of some infections like the measles.
Sure. So, I think earlier in the last segment, I had mentioned that in the last few years, we've seen that, there's been kind of a slower uptake of vaccines. And that includes not just the adult vaccines like flu and RSV and COVID, but also childhood vaccines. There's data now showing that, in the last few years, there's been more and more kids that have not gotten routine vaccines. And unfortunately, I think that's coinciding with us seeing more of these childhood infections that were, essentially almost eradicated. They were very rare, and they're starting to make a comeback. And I think one that's gotten a lot of attention, and rightfully so, is measles. Measles is an infection that, for the last few decades, we hadn't really thought much about. We never really saw it circulate widespread. But now, as we see fewer and fewer kids getting routine vaccines, including measles vaccines, we're starting to see some concerns about, increasing measles cases here in the U.S. and also other countries as well.
So the case of the measles, the rates go up?
Yeah, so we see measles is like it's a very highly contagious virus. Even more so than these other viruses that we talked about, like flu and COVID. It spreads very quickly. As we've seen fewer and fewer kids have immunity from vaccination, we're seeing more kids develop infections. I think that's concerning. This, like I said, this virus can transmit very quickly. We're seeing outbreaks, particularly in groups of kids that aren't vaccinated, either because they or their parents have declined vaccination, or we see very young children that aren't quite old enough to get vaccinated, and they can become infected and get really sick from measles. So, I think this is something that's raised a lot of public health concern. Recently there have been some published outbreaks of measles, here in the United States, I think it's an infection that we had almost forgotten about because we weren't seeing it very much because such a large percentage of the population, particularly here in the U.S., is vaccinated. But now, we're starting to see it more and more often. And I think that does raise some concerns.
Now, what exactly are the measles and what causes them?
So measles, so it's caused by a virus. This is a virus that, like I said, spreads very quickly. And in terms of symptoms, we see a wide range of symptoms. Some people can get very high fevers, a lot of upper respiratory infections. But then, we can see very severe infections as well. So people developing severe pneumonias. In a relatively uncommon situation, we see the measles virus infecting the brain, and that can be something that's, very serious, even deadly. I think, the spectrum is wide, but there is a potential for really severe cases. And, people can still die from measles. Like I said, we haven't really thought about that much in the recent decades, but, in the earlier part of, the 20th century, we were seeing people dying from measles, and it can be quite a serious infection.
Now, as far as, obviously, you can go out and get a shot for the measles to try to prevent it, correct?
Yeah, so the measles vaccine it's really kind of a standard childhood vaccine. So it's a 2-dose vaccine that most kids, even now most adults received in childhood, and that provides long-standing protection. So it's readily available. It's still part of the recommended routine childhood vaccines. But as we see more and more kids who aren't getting the recommended vaccines, we see those kids that are unprotected and vulnerable to getting measles infection, including very severe infections.
Now, can you get the measles vaccine and your COVID shot at the same time or no?
You can. Like I said, generally, measles vaccines aren't really given to adults. They're really given mostly to children. So it's a 2-dose vaccine for children. The first is given around 1 year of age, and then the second dose is given between ages 4 to 6. So it's really given mostly to children. So we don't really vaccinate adults for measles like we do for COVID. Because most adults have gotten childhood vaccines and are protected. We have an older cohort, so generally people born before the late 1950s that have probably gotten that are presumed to be protected from having had measles in childhood. So they don't need to be vaccinated as well. There's no recommendation to vaccinate them. Like I said, really, this is a vaccine. This is a virus that we see the biggest impact on children, and that's the group that really is the focus for vaccination.
And obviously, if you're a child and you need to get vaccinated, you can just go to your physician and have them do it?
Yep, any pediatrician that offers vaccines offers the measles vaccines as well as the other childhood vaccines. So those are very, very readily available in pediatrician offices, and that the access to vaccines, at least here in the United States, shouldn't be an issue.
Now let's talk about STD issues with syphilis in newborns.
Sure, yeah, so that's another hot topic in the infectious disease world. In the last few years, unfortunately, we've seen higher rates of some of our sexually transmitted infections, so chlamydia, gonorrhea, syphilis. And then I think the most unfortunate thing is we've seen an uptick in what we call congenital syphilis. So these are babies that are born with syphilis in the situation where the mother is infected late in the pregnancy and at the time of birth. So, or even at any point in pregnancy. So, we're seeing an increase in babies born with syphilis. And syphilis, when it occurs in babies, is very severe and very debilitating, and can be permanently disabling to the babies. And that's something that I think we really need to avoid. That's definitely gotten a lot of concern.
Now, what exactly is syphilis?
So syphilis is an infection caused by a specific kind of bacteria.
Okay.
It's generally sexually transmitted. So we see, like our other sexually transmitted infections, chlamydia, gonorrhea. Syphilis is probably among those three as the most common group of sexually transmitted infections. And generally in adults, when it's acquired, it causes symptoms in the genital area, and generally very treatable with antibiotics. And as I said, the recent concern in the last couple of years has been the increase in babies being born with syphilis, and that's really dangerous to the baby, and can be caused like very severe disability.
What type of disability?
So it can affect the brain. So we see.
Gotcha.
Yeah, we see babies born that have neurological impairment. Really, it can be devastating. And a lot of these situations, if babies are born with infection, they need to be treated, but some of the neurologic effects may not recover.
Aha. Now, how about we talk about antibiotic resistance?
Yeah, I think we may have discussed that in one of our previous discussions. We see, bacterial infections, have always been very common with us. And, as we use a lot of antibiotics, we start to see the emergence of antibiotic-resistant bacteria. This is something that has been an increasing problem in the last century or so, ever since penicillin was invented. The more we use these antibiotics, the likelihood of developing resistance to them becomes a major public health issue. And that's in my clinical work. That's a big part of what I do. I take care of patients that have bacterial infections that are resistant to a lot of our first-line antibiotics. So, I think it emphasizes that we need to be mindful of our antibiotic use. Sort of use them when they're appropriate, but not overuse them, because that has that impact of leading to more antibiotic resistance among bacteria in the environment.
Now, as far as we're actually going to go back to, we've got some time, so we're going to go back to the top and talk about how important is it that you go get your flu shot?
I think very important. I think flu is an infection, I think that, has been a major public health threat. I think with the COVID pandemic, we had so much of our mindset that shifted to COVID, and rightfully so. COVID, caused devastation in the early period of pandemic. I think we're forgetting about flu and that it can be really a major problem. And we do still see folks come in with very severe flu infections. I was on call in the hospital and I saw patients who were hospitalized with the flu. We have a vaccine that has been around for a long time. I think we have a lot of confidence in its safety and its effectiveness. I think it's really important, to get that vaccine to protect yourself going into the flu season. So again, something that may have fallen off the radar, but I think we need to sort of bring our focus, and especially this year's flu season, which seems to have been worse than the last couple of flu seasons. I think people should be not forgetting about these routine vaccines like flu vaccine, despite all this emphasis that we've had on COVID, in the last 3 years.
Now let's talk about the shingles vaccine and what that does, but more importantly, let's start with the easy question. What is shingles?
So shingles, another viral infection. So, shingles is caused by the varicella virus, and this is the virus that causes chickenpox infection. So when people get their first infection with varicella virus, and that's usually in childhood, it causes chickenpox. So, fever, the classic kind of rash with bumps all over, and that lasts for a few days. And but the issue with this varicella virus is that it remains dormant in the nerve tissue, and that can reappear as shingles. Shingles is essentially a rash that develops that can be incredibly painful. It's the result of reactivating this latent virus, this latent varicella virus in nerve tissue. I suppose we'll want to discuss the shingles vaccine as well.
Sure.
And this vaccine is given to folks to prevent that reactivation from occurring, and prevent those episodes of shingles, which can be quite painful and debilitating.
Now, is there a vaccine for shingles?
There is. So the shingles vaccine is available. There has been a shingles vaccine that's been available for many years. I would say maybe even decades. I don't remember when it first became available. But now we have sort of a second generation of shingles vaccines that is even better in terms of effectiveness and less side effects than the first vaccine. So I think it's an important vaccine, particularly for older individuals. It's generally can be given to anyone over the age of 50. But as people get older and older, the risk of developing shingles increases. So I think, I don't know if anyone's known anyone who's had a case of shingles, it can be very painful. So anything that can be done to prevent it, I think, is worthwhile. The vaccine is the way to do that.
Now, should you get the shingles vaccine every year?
No, this is not a virus that changes like COVID and flu. This is a vaccine that is a 2-dose vaccine, and essentially it's a one-time vaccine, and that you get long-lasting immunity from getting that initial vaccine series. It's actually technically a 2-dose vaccine, but after getting that initial vaccination, you have long-standing protection against shingles.
Now, how painful is shingles?
Can be quite painful.
Could it?
It's variable. Some people have milder cases and get the rash and get a little soreness, and it passes over time. But some people get pain to the point where you can't even touch the area that's affected. It's too sensitive. It's too painful. We've even had people who had such severe pain that they've had to come to the hospital to get pain medication because of how severe their pain was. So it's a wide spectrum, but it can be quite severe. Like I said, the vaccine is a great way to prevent that from occurring.
Now, if you were a kid and you got chicken pox, as an older adult, should you still get the shingles vaccine?
Yes. Yeah. So remember, chicken pox is the initial infection, but then that virus can lay dormant in the nerves. If you've had chicken pox, then you're still at risk for having that sort of reactivation, which is shingles. So having had chicken pox in childhood would make me concerned that you'd be at risk for reactivating in adulthood. So that shingles vaccine helps prevent that.
Now, with all the vaccines out there in the world, is there a vaccine for chicken pox?
There is. So that is relatively new. So now, we give children a vaccine in childhood to prevent chicken pox. That I think became available maybe like about 20-ish years ago or so. So now we give children vaccine to prevent chickenpox infection, the initial chickenpox infection, or at least to reduce the severity of it. So we don't see kids coming in with severe chickenpox like we had maybe 30, 40 years ago. I guess the concern would be, like we talked about earlier, with kids not receiving routine vaccination. They would be at risk for getting that really severe chickenpox infection. But the chickenpox vaccine is available to children and part of the routine vaccine schedule for children.
Now, obviously, can you get the chickenpox vaccine and the shingles vaccine at the same time, or no?
No, they would be different. So the chickenpox vaccine, to prevent that initial infection, reduce the severity of the initial infection, that's given to young children, whereas the shingles vaccine, to prevent reactivation of the virus causing shingles, that's given to older adults. So different populations for the different vaccines.
Now, how important to you is it to go get your shingles shot when?
I think it's important. I think the shingles, infections, as I mentioned, they can be very severe, to the point where, people are in terrible pain. And if we have a way to prevent that severe infection from happening with the vaccine, I think it's important. Like I said, the second generation vaccine that we have available now, it's called Shingrix, is even better than the initial vaccine. It's a very immune stimulating and provides good immune protection. And unlike the prior vaccine, the first shingles vaccine that was available, this is not a live vaccine, and it's not putting any risk to developing infection. So I do encourage folks who are eligible to go ahead and get that shingles vaccine to provide protection against shingles.
Can you maybe tell us a little bit about the shingles vaccine?
Sure. So it's a vaccine that's available to folks over age 50.
Okay.
I think it's a very well tolerated vaccine. It generates a good, robust immune response. It's not a live vaccine. It uses more traditional vaccine technology, so it's not like the mRNA vaccines that came available for COVID. It's got good data behind it in terms of safety and effectiveness. So I think it's worthwhile to go on and get if you're eligible.
Now, once you're eligible and once you got the shot, how often does
this one again is just a one-time vaccine, so it's not the kind of vaccine that you need to get repeated doses of, like a flu and COVID.
Gotcha. And now, as far as getting your flu shot, obviously you're all for people going out to get their flu shot, correct?
Yeah, I recommend it. The CDC recommends that anyone over age 6 months should go ahead and get a flu shot each year. Like I mentioned a little bit earlier, generally we want people to get it in like the fall, early winter, because flu season tends to peak kind of around now. But it's not too late. So a vaccine is still available. You may still get protection in the coming weeks and months. So if you haven't gotten one, like I said, it's readily available. It's well tolerated and still can offer protection in the weeks to come.
Now, as far as COVID goes, what do you think people can do to make sure that they try not to get COVID?
So, I think the first step is to get a vaccine, particularly if you're at higher risk for severe infection. The vaccine is really important, and getting the updated booster for those who are eligible and at higher risk is really critical. So that's the first step. There's other measures that I think we're seeing used kind of less commonly, things like masking. We're not seeing in the general public mask wearing like we had in the past. For those individuals who really want to exercise additional caution, masking I think is appropriate. I take care of some very vulnerable patients who are very immunocompromised, and even after getting a vaccine, they want to be extra cautious, and rightfully so. Wearing a mask is an added layer of protection as well. So I think those are kind of the main things that we can do. I think there's some general measures in terms of preventing infections, particularly in the wintertime, like hand washing and trying to avoid being in contact with people who have symptoms and are sick. Those kinds of measures I think are still really important. And that's for COVID, but also for all the viruses that circulate in the wintertime. So things to be mindful of if you really want to protect yourself in these months. There are those measures that you can take. But I think vaccination is really the best option to prevent severe infections.
Now, as far as Lyme disease goes, is there a vaccination for that?
Interesting. So there had been. There was a vaccine that was initially made available, maybe like a decade or two ago, okay. And it didn't actually take off. I think it's a little unclear as to why it didn't become readily available on the market, and the pharmaceutical companies kind of didn't invest in it further. But this is an active area of research, so there's still a lot of ongoing research to develop safe and effective Lyme vaccines. So we may see one in the future become available again. I think it's something to stay tuned on, especially here in Connecticut, where we see Lyme disease being relatively common.
Now, as far as we're in the beginning of the winter months, and do you think there's going to be an uptick in COVID from the winter to the spring?
Hard to predict. I think, we tend to see COVID kind of come in waves. And in the last few years, it's been waves here in the U.S., particularly in the Northeast, that have been more severe in like the wintertime, so like December, January. So I think, we can be optimistic that things will settle down in the coming months, but, we may see spring surges. Some of it depends on, changes that may occur with the virus. So when we see new variants emerge, that can lead to, more frequent infections. So, with COVID, I think if anything we've learned, that's to be sort of humble and cautious about predicting the future, and to be mindful kind of what we're seeing, in the community.
Now, do you think there could be an uptick in the spring?
I think anything's possible. Again, using the recent years, here in Connecticut, the last couple of years, we've seen mostly upticks occur in the wintertime and maybe, a little bit of an uptick in the spring. But, I think it's always difficult to predict. Like I said, with this virus, we haven't quite settled into seasonality like we've seen with flu and RSV, where we can more reliably predict generally like what time of year we're going to see upticks. With COVID, I think it's still relatively new. Even though we're 4 years in, we're still learning a lot about the epidemiology and the way that waves occur. That it's just difficult to make any firm predictions for what to expect in the months ahead.
Now, a virus like COVID, how long does it normally last from start to finish? A couple of years, or?
A virus like COVID. Well, COVID's one of a kind. So I think it's, that's kind of what made it so unique, that it was a novel virus.
Right.
So I just think it's difficult to make predictions as to whether we're going to see this occur as like a seasonal virus, or if this is something that's going to, potentially temper down. I don't think we're at a point where we expect it's going to be gone completely. It seems to be now settled in as being kind of so widespread that it'll be with us.
Okay.
I think the hope is that people will be protected from severe infections through vaccination, through previous infections. That we won't see that severe impact like we saw in like the first year or two of the pandemic. But we'll see. I think as I mentioned earlier, we should be humble and kind of be prepared that things may change in the future, and we'll have to respond accordingly.
Now, do they still report the numbers if people of the percentage of people that test positive for COVID?
So the surveillance that we do now is a little bit different. Because a lot of people are testing and, with using home tests and not reporting them, or not testing at all, it's hard to rely on that percentage positivity like we used to, just because the data isn't being captured as it had in like the first year, couple years of the pandemic. So we use other measures, like we still can track kind of the number of patients coming to the emergency room testing positive for COVID, because those tests do get recorded when they're done like in healthcare facilities. So we can use those as kind of rough estimates of how much COVID is circulating, and that helps us kind of understand the trends. So comparing now to what it was like maybe a few weeks ago or a few months ago. So I think we can sort of track the trends to some degree, but we don't have that detailed data like we used to have on percent positivity, just because the data is not being collected and captured at that same level.
Now, as far as hand washing, trying to prevent COVID, what is the proper way to wash your hands?
Good. So hand washing, is still important, and that's not just for COVID. For preventing, other infections that can be acquired through contact with surfaces. Right. Things like flu and even like gastrointestinal viruses, can be transmitted that way. So hand washing, is still important. I think now. We've had a lot of movement away from kind of soap and water to using hand sanitizer. The hand sanitizer is very effective in cleaning the hands. So I think hand sanitizer now is probably in a lot of ways replacing hand washing. But I think the key is using an adequate amount of hand sanitizer, letting it kind of dry, and that, and coupling that with like routine hand washing. So making sure that, you're adequately covering the hands with soap and, those kinds of things, and being thorough about washing hands, I think can still go a long way.
Now, as far as the hand sanitizer goes, I know there's probably a bunch out there in the market. Are they all the same type of formula, or is there
Yeah, I mean, they're generally different formulations of ethanol. I think, they're all now using the same kind of ingredients. Some of them have chemicals added, sometimes to help with like the scent, to make the scent more appealing.
Okay.
But in terms of like the actual cleaning and disinfection liquids, they're all pretty similar. So I think anything that's kind of a commercially available hand sanitizer, is probably a good option.
And obviously, it's a better option to wipe your area down with an antibacterial wipes or a Clorox wipe.
Yeah, if you really want to clean the environment you're in, that would be an added measure to provide protection. But I think, when it comes down to it, we touch a lot of surfaces all the time. A lot of shared surfaces, things like door handles and whatnot. And it's kind of not so practical to wipe everything down all the time. So, the next best option is cleaning your hands after you touch something that maybe other people have touched recently. And, cleaning with soap and water or hand sanitizer is effective.
Cool. Well, Dr. David Banach from UConn Health, we're about to run out of time. So I want to thank you for coming down, and hopefully we'll see you again soon.
That sounds good. Thanks for inviting me.
All right, thanks. On behalf of Dr. David Banach, I'm Pete Mezzetti. Thanks, good night, and we'll see you next time.